How should I become a aesthetic or a cosmetic dentist after BDS? Is a question a lot of y'all have asked us. So in today's video, we are going to answer the following. Number 1. What is aesthetic or cosmetic dentistry? Number 2. What are the skills you need to develop in order to be a good aesthetic dentist? Number 3. How do you master these skills? And the fourth point would be how to set a practice where you get aesthetic and cosmetic patients. If you are interested, stay tuned. Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed. The first part, what is aesthetic or cosmetic dentistry? Aesthetic dentistry is anything which helps mimic the natural tooth appearance. It could be anything from a normal scaling, tooth whitening, to doing a good posterior composite which mimics the natural tooth. Cosmetic dentistry, on the other hand, is something which enhances the beauty of the oral cavity. It could be anything from orthodontic treatment to veneers to full mouth rehabilitations. Now these are related to the white or the teeth part of the oral cavity. You have cosmetic procedures for the pink or for the gingiva. These could be including gingival recession coverages and depigmentations. Most of the times, these words, aesthetic dentistry and cosmetic dentistry, are used interchangeably. Now, what are the two skills you need to develop so that you're good at this? The first one is diagnosis. Yes, imagine your work is really good. You give two amazing veneers to close an anterior diastema, but later it tends to relapse. Reason? You fail to diagnose either a tongue thrust habit or a high frenal attachment. So before improving just your hand skills in aesthetic dentistry, diagnosis is a very important part. The second most important thing is your clinical or hand skill. Imagine your neighboring dentist has a degree in aesthetic dentistry from one of the top universities of the world. A patient goes to him or her, gets a restoration done, but is not happy with the finish. The patient walks into your clinic. Your work is really good, but you do not maybe have a degree to back it. You do an amazing job. Later, when the patient requires further treatment, maybe aesthetic or otherwise, or has to refer a friend for an aesthetic treatment, where do you think the patient will go? Of course, to your clinic. So remember one thing, aesthetic dentistry is not about having a degree in it. It is about providing treatment which improves the smile of the patient. Now, what you can do to improve your aesthetic skill set? The first point is read a lot. The knowledge we have about aesthetic dentistry or anything in dentistry in general is continuously expanding. So reading lets you be updated with what is going on right now. If you're starting with aesthetic dentistry, you can start reading basic books like Wheeler's, where you have an understanding of the anatomy of teeth. That will give you an idea of what you want as an outcome or the end result. Then you can read further books. Like if you're planning about veneers, you can read Gallup Gurel. If you're thinking about composites, you can read layers. Finding specific books which help you understand improve your knowledge about the field is extremely important. The second thing you can do is attend courses related to aesthetic and cosmetic dentistry. You would be thinking, I just stated that degrees are not important. Yes, just getting a degree is not important, but attending these courses help you understand the field better. How? Because the mentors who are teaching these courses read all these books and based on their experiences condense the knowledge in a form which you can easily understand and apply. So attending courses, maybe a 1 day or a 2 day course, a 6 or 7 day workshop, or even a fellowship of a year or two would help you understand aesthetic dentistry or any other field in dentistry in better. Third is to join various offline or online groups where topics related to this field are discussed. There are a lot of Facebook groups or WhatsApp groups where people post their entire treatment protocols for a given procedure. And a lot of times there are healthy discussions related to whether that was the right approach or the wrong one. In that discussion, a lot of people benefit by reading. It helps them understand the concepts and when they get such a case, how to go about treating it. The fourth point is practice, practice and practice. The more you work on your skills, it will improve. If you do not have a lot of patience initially, you also can work on extracted teeth or diphotons. Continuously practicing gives you an idea of what you want to do as an outcome when the patient arrives. Before we move on to the 3 tips about what to keep in mind while setting up your practice related to aesthetic dentistry, I would like to request you, even if you get 1 point out of this video, do not forget to hit the like button below. And I'm sure you're subscribed to our channel so that you can keep up to date with the content we give about taking your career to the next level after BDS. The first point you need to keep in mind while setting up your practice is location. If you put your clinic in an area where the patients do not go in for elective treatment, maybe they cannot afford it or are not interested in it, then it is difficult to do aesthetic procedures in such cases. So finding an area where the patients are keen on getting aesthetic treatment done is extremely important. Soft skills is the second point you need to consider, because patients who walk in for aesthetic treatment expect you to take care of their concerns and answer all their doubts in depth. So not just the clinical skills, you should also develop the soft skills when you plan to set up your practice. The third point is documentation and consents. When you're about to start the case, explaining the patient what the final outcome would be is extremely important. The patient and you should be on the same page. That's why having mock models help a lot. It shouldn't happen that the patient is expecting one result and you are delivering other. These patients might be extremely demanding. So documenting all your steps and taking consents are important. So these are the 3 points you need to keep in mind when setting up a practice to do majorly aesthetic and cosmetic procedures. I hope you got something out of today's video. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.